that you actually read, you're able to, and what are the latest studies?
Well, the one that I have, the most recent one, is by Dr. Morgenthaler. Was done in 2011, in February of 2011, and he's done a lot of studies. He is the prostate cancer and testosterone guru. Okay, he's got studies in life extension. I mean, articles in life extension. He's got studies all over the place for this, and he tells you the progression of how it started with Huggins, and then it will go through and tell you how the evolution of prostate cancer has become. So his most recent study that I have, and I know they're looking at doing probably bigger studies with this, but they have a study. It's not the greatest. It's 12 patients. But think about it. You have prostate cancer, and are you gonna enroll in a study they're gonna give you testosterone if all years, oh, if you don't take testosterone, it's gonna make it worse? No, but these guys volunteered, 12 guys. All of them had what they had. They staged prostate cancer from a scale of 1 to 10. That's called a Gleason score. 10 being worse, 1 being mild. These guys were all of them except for one were 6 and one was a 7. So it was pretty moderate disease.
Right.
They also were symptomatically low testosterone. They were in the 300s. They had symptoms of it. So these guys were given testosterone. I think the average time was 2.5 years. When they first did the study, they did biopsies of their prostates. 100% of them had prostate cancer. Of course, all of them had prostate cancer. At the end of the study, 54% of the biopsies that they did, because they did biopsy every year,
Okay.
54% of the biopsies were negative for prostate cancer. Their testosterone level, I think, was about 600 to 700. So when testosterone makes it worse, when you expect it to make it worse. Now, it's not the greatest study. It's better than one patient,
Exactly.
but it's not the great. And there are other studies. There's several other studies that show that testosterone doesn't, especially if you get it to high levels, it's not going to cause problems with prostate.
Are we going to fund more research? Are we going to have more doctors?
He's going to probably do a larger scale study now based
Okay.
on this.
Which is great.
It's in the pipeline. I know it's going to be more people. They have to do it, and probably going to do a randomized controlled trial on that too.
Well, yeah, what is the ratio of people that they want? What is the percentage of people that makes a good study?
I would say, the more the merrier.
Okay, I say that too,
Yeah,
yes.
I think I've seen studies with, for example, there was a testosterone and estrogen study in men that was recently done in 2000. It was 400 men.
That's good.
Some of the bigger studies, like the Women's Health Initiative, was 372,000 women. So the more people you have, the more data you have. So.
Right. And we need more data. We need
Yeah.
more